everybody. Welcome back to Common Ground Conversations. I'm Dr. Bonnie Nussbaum, America's kick-ass coach and psychologist, and this is my friend, JoNeil Conley.
I'm Dr. JoNeil Conley. I specialize in bullying. I consider myself a bullyologist, but I'm a coach, I'm a nurse, I have a doctorate in healthcare administration. I got all kinds of degrees, but more importantly is both of us are real life women living in this world that we've got,
Human beings.
trying to
Yes.
offer you some thoughts on areas that we consider something we might be able to do something about.
Yes, and we just had some great discussion around the whole concept of aging in America and what does it mean and where have we been handed a bill of goods?
Yeah.
And maybe we need to take a look at the the beliefs under which we are operating, many of which are not serving us.
Yeah. Because guess what? We're all going to be at end of life at some point in time.
And
So,
we've got this huge influx of baby boomers, the group of us that were born from 1946 to 1964.
yeah.
We're all hitting Medicare right now.
Yeah.
And so there's going to be a plethora of us going through the
Yes.
systems. And so we want to help you understand the scope of some of what's going on here and how we don't even realize the waters in which we swim.
Yeah. And how this relates to common ground conversation is giving you some strategies to empower you to have some of those dicey conversations about with your family, with your friends, with your healthcare provider, with all those pieces. And how can you be in a position where your wishes are carried out in a safe and effective manner?
Right. And one of the books that we've been
Yeah.
reading is called Being Mortal by Atul
Hmm.
Gawande. He's a physician,
Yeah.
and he's basically questioning how we have set things up in America in terms of dealing with people who are aging, making it a medical problem
Yeah. Yeah.
as opposed to a cultural issue to be addressed.
Hmm. And I can share from my nursing perspective. I've been a nurse for almost 50 years. It's almost looked at like death. The is failing. If you die, it's a failure, and it's a procedure, and it's a this, and it's a that, and we also look at when other just with the economics of it, they will pay for a new heart, but not comfort care in a facility. So there's all kinds of things that are kerfuffled in the healthcare system.
And until you start wading your way through it and hitting those things where you go, are you kidding me? People don't realize how messed up the system is.
Oh,
So we'll help you learn.
yeah, yeah. And a couple caveats here. One, if you are the person needing care, or if you a loved one trying to help someone provide care. And I think Bonnie's got a whole bunch, she's had a situation with her dad over this past year where she's learned all of this stuff firsthand and has had and then we had siblings into the mix. And we had
Yes.
all
Learned in
kinds of
not
things
fun ways. Yeah.
in all kinds of things. And they required common ground conversation on your family's part just to start
Yes.
the discussion.
Yes. And oftentimes the default is, well, he has to be safe. I wholeheartedly drink that Kool-Aid
Hmm.
completely.
Hmm.
And what I have learned in the course of this year is he would much rather be feeling like he has purpose and that he has value and to hell with safety.
Yeah. Yeah. And I was explaining to Bonnie the other side of the story within these facilities is
Hmm.
that if you have give the example of a lift. If you have a policy that says two people must help in this transfer and this carry and all that, and if you only have one person and then the resident or the patient gets injured and you haven't followed your policy, all kinds of citations can happen. Not
Hmm.
only the person having injury or but the
Hmm.
organization is at great risk too. So
Right.
that default to safety oftentimes is at the expense of the individual's capacity, shall we say, or
Sovereignty. Yep.
sovereignty.
It
Yeah.
very
So
much infantilizes people. You're not
yeah.
allowed to get up and go to the bathroom by yourself. But gee, you're on a diuretic and you can't wait when you hit that buzzer and it's going to be 10 minutes till they show up.
Yeah. Yeah.
You know?
So based on sort of your experience, and I've had one too with my parents, grandmother, but yours is real fresh and real new. Um, can you look back and say, I wish I would have done, or I wish I would have known before?
I wish I would have read this book
Okay.
prior to, I mean,
Okay.
this kind of came along in the middle of our process.
Yeah.
Um, I can't speak highly enough about the various agencies, the palliative care nurse, the people who have stepped up. That's their job to
Yeah.
help educate us about the system because we don't know what we don't know. We don't even
Yeah.
know what questions to ask. And it's not like I don't have a healthcare background. It's not, it's
Yeah.
mental health, but
Yeah.
even then, and I looked at my sister, who's a pharmacist and worked in
Mm-hmm.
a university hospital for 40 years. And we
Yep.
looked at each other and said, really, are we this stupid?
Yeah. Yeah.
And if we're having problems with this, what about
Mm-hmm.
people who have no medical background at all?
Yes. Yes.
Yeah.
Yes. Yeah.
And
And
maybe have their own issues they're dealing with.
mm-hmm. Mm-hmm.
Yeah.
And the only kind of comparable is I can walk into any hospital in America and pretend like I work there because they're all pretty I know the ins and outs. Now, when I was going through a divorce, the legal system was something I knew nothing about. And it terrified me, and I made some stupid decisions because I didn't know. And I thought that was a real eye opener for me. The person who's at the front desk going, "My dad's in," they don't know the system like I know
No.
the system. And for
Right.
me to assume that these are very intelligent people who hold down, do all kinds of things, but you've put them in an environment, first of all, of fear, of
Yes, they're
of
in distress.
yeah, policies and procedures they know nothing about,
Right.
practices that we can do in our sleep and take, and a
And a lingo, a
I was going to
whole
say
lingo
that was where I was going.
that is, yes,
Vocabulary that's
yes.
full of acronyms,
Mhm.
and this means this, and it's like you need your own dictionary to come in. And one of our first steps would be say, time out. I don't know what you're talking about. Tell me what that means. And that is no reflection on you, your
No,
intellect.
we've been trained to believe that physicians are God with a little g and not to question too much, especially my parents' generation. I'll just share one story here. My father fell off a roof at 70 years old. The only thing that saved
Yeah,
him was he hooked his foot in the ladder on the way down. Contusions all over his face.
yeah.
He drove himself home,
Mm-hmm.
and I happened to call at that point in time, and my mother says, "Well, your dad fell off the roof. Get to the ER. What are you doing?
Exactly.
This is a 70-year-old man with facial contusions. He's probably got a head injury."
Yeah, yeah.
So she took him there, and the doctor looked at him and said, we're really busy today. Can you come back tomorrow?
Oh my
And they
gosh.
turned around and left.
Yeah, yeah,
And
yeah,
so we hauled them to a different facility
yeah,
to address it. And he was
yeah.
hospitalized for 14 days and almost
Uh,
lost his foot.
duh. Absolutely.
But again, they would never question it. They would never, my parents would never ask. They would
Yeah,
never say, wait a minute, I don't understand.
yeah.
So we're encouraging you, please speak up, ask questions, risk feeling stupid, say what you
Yeah,
need.
yeah.
I'm not
You know,
getting any of this. I need you to help me say this in English, not
yeah.
Dr.
My
E.
my my daughter had a situation of advocacy. She took her 3-year-old child to the university hospital, and the doctor said, "Yeah, I can cure this. I can cut this. I can do this, but her face is going to droop. She won't be able to suck out of a straw. She'll be deformed." This is a 3-year-old, and my daughter goes, "What's Plan B?"
Because
kind of a thing. And
we're not going with plan A.
he
No.
was taken aback, but I have to give this man credit. He kind of walked away for a little bit, and he came back. It was almost like this person is challenging me, but I think it's okay what she's. But his initial reaction was like, "Who do you think you are?" And you got to
Hmm.
remember, my child's a little bit gutsy. She's raised by me, but not every. And he said, "We'll
Not
do Plan
everybody
B.
is.
We'll do something different. It's going to have a longer recovery time, but the chances are we won't be faced with all of those side effects." So again, it's not just old people you advocate for, kids, yourselves, all
Hmm.
the things. And that was just
And
another
that and
example.
that's why I would suggest you have to have someone with some medical background.
Hmm.
I've had clients who've hired retired nurses to be their advocates because they don't know. The doctor will say, well, let's use this medication. and they don't know anything about that medication. Whereas your advocate can say, wait a minute, she's on this. Those won't go well
Yeah.
together.
And there are nurse advocates. There's an agent, there's agencies, there's
Mhm.
companies, and again, or a family friend. I don't know how many times people have called me and said,
Mhm.
is this making sense to you? I go, I don't know enough about the situation. Let me just give, again, I'm willing to listen and I'm willing to do all that. But so step
But
one is
yes, even to hear, it would be wise for you to ask about this.
yes, 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 all the
Yeah,
things.
all
And I
the
guess
things.
our first step, I think that we've kind of congealed here is don't be intimidated, ask questions, say no, be in the moment with whatever.
Do a
Time out.
timeout when you need to.
Yeah,
This is, think about it this way. This hospital, this physician, this nurse, they are your employees. You're hiring them to do
yeah.
something for you. You are
Hmm.
paying the bill. Yes, your insurance company's paying the bill, but you pay the premiums.
Yeah.
So empower yourselves.
Well, and I don't know how many times I've heard this. If I rock the boat, they won't get good care. If I say something, the nurses will take it out on them. And I don't know. I don't know. I've never seen that happen, but that is what I've heard from I don't know how many people in my
They're
career.
fearful. Yes.
Yeah.
Agreed.
I think to me, you're better off saying than not saying,
Yes.
you
And there
know?
are those practitioners who actually are grateful that you bring stuff up because
Yeah.
you know you the best and you know
Yeah.
your loved one better than they do. Well,
Yeah.
wait a minute, they're on this medication or they had this illness or injury in the past that might be
Right.
relevant here. That's so
Right.
important.
Yeah. The other thing in this conversation that we talked about was actually in your doctor's appointments, not even at the time of
A crisis.
yeah, of a crisis. As you go through finding your practitioner, finding changing your, whatever that looks like, your appointments. And we were having the conversation. One of the gals' son was a PA, and he was talking about how the timer's ticking, and he has to see so many patients in so much amount of time, and quotas and all of that.
15 minutes, get them in, get them out.
Yeah. So again, this is just me. I go in with my list. Whenever I had just the other day, I had a follow up. I had some lab work drawn. I had my list, and not everything on my list was about that lab work, kind of a thing. So be prepared and work with your practitioner, whoever that person is.
And it doesn't mean you have to accept hook, line, and sinker what you're told either, because how often have we gone in with our lists and there is something that doesn't relate to X, and they tell you, well, you'll need to make a separate appointment for that.
Mm.
If you go, okay,
Yeah,
you're going to be
yeah,
making a separate
yeah,
appointment. If you say, this is going to take you 2 minutes to answer my question,
yeah.
just answer my question.
Right. And we blame the physician, the practitioner. I mean, and they're kind of an
They're
intermediate. I mean,
pinched in the middle.
they are pinched in the middle. They are pinched in between, and they know that they've got a schedule that looks more than they could ever possibly done. And I believe they genuinely want to deliver good care. I
Well, and
believe
why did most of them go into the profession in the first place? Because they
exactly.
care
They
about
cared.
people.
They cared
And
about.
I just had a client who gave up her medical career as a physician because she cannot do it the way it's expected to be done anymore.
Yeah.
Work a full shift, then you're on call the whole night, then you work another whole shift,
Yeah.
and there, 4 or 5 things coming off at the same time. You can't be 4 or 5 places at once, but they expect you to. They
Yeah.
expect.
So we've talked about what advocacy a group might be able to do. We're looking at what that might look like, and people hearing, the baby boomers out there who are watching. We are like the biggest block of people.
We are
Um,
powerful,
yeah,
powerful beyond measure when we get
yeah,
our voices together
mm-hmm,
and come forth with specific things that we would like to see.
mm-hmm,
Mhm.
yeah, and that's where the common ground conversation comes, and we keep going
Yes.
back to what the title of this program has been. And this just happened to come about finding that common ground. And I would also say the common good, the common
Mhm.
good, because all of us are at the mercy, I say the mercy of the healthcare system that what we have here. We're
Mhm.
not, there may be Canadians and other people that are listening, but for the most part, we're talking to an American, North
Right,
American.
which is a for-profit system.
Yeah.
Follow the money. Follow the
Yes.
money.
Yeah.
Our procedures cost more than in most other countries. Our medications cost more than in most other
Mm-hmm.
countries. This is not a system that's really working very well.
Mm-hmm. And I just have to jump in here because this is my own personal pet peeve. The HCAP scores are from the devil. Just so y'all know that. That's JoNeil talking. Those are the scores that when you get that little survey after, how did so and so do? Did they teach you all the things? They're asking you, who don't know what my job is, to rate me on how well I did my job. And
Mhm.
that's how well the hospital is going to get paid. And love it, but it's not a hotel, it's a hospital.
Well, and also think about what we're going to be evaluating it on is based on were our needs met, our perceived needs. And if
Mm-hmm.
that's not her job, of course we're going to flunk her.
Yeah, yeah. And you see stories, and you're doing a cardiac arrest on somebody, and somebody goes, "I need mom's sandwich. I'll be right with you as soon as I'm done pumping here." And that I think that's where the rest of us have to like give grace, understand, and the nurses can't do it all. You said you talked about your family's schedule about being with your dad and
Mhm.
somebody, all that
Right,
thing. And I
right.
hate to say it, but bring your people with you when you go to the hospital. Bring them
Yes,
with you.
yes. And the quote that I heard and I wholeheartedly believe is accurate is the quality of care that you get within that facility is directly related to how many people on the outside care about you.
Yeah,
Are you going to advocate? Okay, hang on a minute. So they put Dad's CPAP machine on. They never
yeah,
turned it on.
yeah,
Every night thereafter, one of us was there to make sure that
yeah,
machine got turned on.
yeah, yeah. My mother-in-law was in a skilled nursing facility, and we would go there every night and watch Jeopardy with her, just because we could. But when I went one time and she was laying in a soiled bed. Now the nurse and me had a absolute terms of
Meltdown.
endearment moment.
Mm.
And the poor remember, if you don't remember watch it, because there's this moment where the mother's like at the desk screaming at everybody. But the little nurse, she was young, she was tiny, she was all the things, and she said, "We just don't have the kind of sling to help her get up to the bathroom." Where the hell is it? It's kind of a thing.
Mhm.
But I
Mhm.
made and so I went home and I said, "Bob, they said everything's going to be okay. Could you go back? Because I'm not welcome back there tonight. Can you go check?" And the next day, the chief nursing officer met with both of us and said, "We are so sorry that this happened. We have this process where the slings go out and get laundered and put back, and there was a mix up with that, and but she addressed us after
Mhm.
my nervous breakdown.
Mhm.
At any
And
rate."
most of us can show some grace when we
Hmm.
understand why something isn't the way we need it to be.
Yes.
So today I went to pick up a couple of medications, and the clerk behind the desk said, "It'll be 5 minutes and it'll be ready." And I went like this, and she goes, "Is that a yay or is that a what the heck?" And I said, "It's a yay, because
Yay.
five
Yeah.
minutes is not a big, hairy deal." But you
Yes.
could see the trepidation in her face
Yeah.
because she's so used to being browbeaten by
Yes.
people who are not offering grace.
Yeah.
This poor
Yeah.
person who's standing behind the register, just trying to do her job.
Oh, yeah. Yeah. So we kind of bounced all around here. Let's see if we can pull some of these things together. I think the first one of our first overarching is advocacy for yourself and your loved one. Um,
I think a second one is if you don't know, find someone who does.
yeah.
Don't try to, I mean, certainly you can educate yourselves, you can Google all kinds of things, but find people that you trust
Hmm.
who are in the field to help you with this.
Yeah. And I think the third was saying, "Time out, I don't get it."
Mhm.
Having that moment of interrupt in a system. And if the doctor's running away from you, you just, "Hey, come back here.
Yeah.
Interrupt this. I
Excuse me, I
don't."
have one more question.
Yeah, yeah. And
Yeah.
that goes back to having sort of having a thought process. And and this, I guess, is sort of the side of this one is the intimidation factor. You know, however you have to get to that place where you
Be
can,
willing to be a disruptor. Be
yeah.
willing to be a disruptor. This world gets so much better when we have disruptors out there. The people who will say, well, why is it that way? Wait a minute, that isn't working because of this, this, and this. What are our alternatives? Be a
Hmm.
disruptor.
Yeah, yeah. And if you don't understand, say you don't understand. And it's not a personality flaw. It's not a personality flaw. So be willing to say, you know what? I make hot dogs at Hardee's. But this is my loved one. So
Mhm.
spend as much
Yeah.
time as you need with me till I
Help me
understand.
understand.
Help
Help
me
me
understand.
understand.
And we
Mhm.
say that all, I think with every common ground conversation, that key
We
phrase,
do.
help me
We do.
understand.
Especially when you're running into something that's difficult.
Yeah.
Those words can be so grace filled.
Yeah.
Help me understand.
And it's okay to say you're scared. I think there's a whole big fear factor. This is someone you love or yourself, and this unknown and changes. And, I could get up on the roof and now I can't get up on the roof. And
Yeah,
I can't,
watching our loved ones decline, knowing that it will end in death at some point, if
yeah.
not this round, somewhere down the road. And we need to be able to talk about that
Yeah.
stuff.
Because didn't we talk on Sunday that um, death isn't a medical event? It's just a passage.
It's a natural part of
Yeah.
life. We are born into this life, we're born into the next life. And
Hmm.
when and if we can have that kind of perspective, it actually can become something to celebrate
Yeah.
instead of something to, I mean, yes, we mourn not being physically with our person anymore, but the belief that they're free of a body that was
Yeah.
no longer serving them, that can be
Hmm.
such a wonderful thing.
For sure. For sure. Well, I think we can kind of wrap up this common ground
I agree.
conversation. But hey, if there's something that touched and interested, would you put it in the comments so we can look at that? We can address it. We can have a separate email exchange or another video to address a
Yes.
topic because we usually Bonnie and I go, what are we going to talk about? But we normally know
We just, yeah.
exactly what we're going to talk about.
And also, if you're feeling like, yes, this was all helpful, this is really good stuff, but I just don't have anybody to talk to, we both do coaching
Yeah.
and we both have walked this path
Yes.
for ourselves and with many, many people.
Yeah.
So if you feel an affinity for one or the other of us, check us out and
Yeah.
see if
And
you,
our
we both do a free initial
yes.
contact so that you can
Yep.
get to know us better and see what we can do to help you out with whatever you're navigating.
And our contact information will be below.
Down
So
below.
listen, this is almost the holiday season. If you're probably not watching this in December, but again, don't get so overwhelmed that you don't enjoy the time.
Yes. Stay in today.
Yeah. All right.
Okay.
Bye.
Bye.